greatest challenge that we faced this year was the response to COVID-19 and making sure that our community and residents were protected against this devastating virus.
And it affected everybody in our community. It affected our businesses. It affected people individually. It affected
everyone. Everybody's been affected. I don't think there's anybody that has gone through this crisis and not been affected.
This required BCH to go into 24/7 planning mode. Every single individual, whether you're the CEO or whether an aide on one of our floors, was rethinking what their positions were going to be during this time and what they needed to do to provide the best treatment and care to the community.
And the only way to address it was to make sure that our public health authorities and our healthcare institutions work together collaboratively.
So we recognized really quickly, along with the Boulder Chamber of Commerce, that we needed to work together in order to be successful. There's no way that Boulder County Public Health could have accomplished getting the information out that was necessary without the support of the Boulder Chamber, who engaged other chambers and economic development councils. It was really that partnership that allowed us to reach businesses across multiple sectors, to provide information sessions, to gather feedback from businesses on what was working and what wasn't.
From the stay-at-home orders, it became very apparent that we needed to be clear in our communication with businesses and make sure they had an outlet to be able to ask questions. So the Boulder Chamber stepped up along with the Latino Chamber of Boulder County and Boulder County Public Health to create these series of webinars and opportunities for businesses to hear pretty regularly the updates to public health orders, to get communications and to ask questions.
The collaboration for BCH was really grounded in what was our greatest need that day and preparing to provide the best treatment and care to the community. At the very beginning, that was all about personal protective equipment. We went to CU Boulder, we went to manufacturers, we went to other organizations. We literally had individuals bringing us masks from their basements. So it was truly a barn-raising moment that the community came together at the beginning to help support us. Longer term, that collaboration led to how do we support our frontline providers? Out of that came a program called Feed the Frontlines Boulder. That was a unique program where you had tech entrepreneurs, you had over 25 restaurants, you had long-term philanthropists in our community that all came together to say, one, how can we help support our restaurants that are struggling? Two, how can we make sure we deliver meals to those that are really working the hardest on the front line right now?
What happened in my situation is one of the local CMOs from the large health systems reached out and said, we're getting a group together and we want to, learn from each other, work together, collaborate. And so what we started to do is recognize that as we all work together, we can learn, we can adjust, and we can develop plans together and be much more effective.
So thus far, we've had over 185 webinars in collaboration with Boulder County Public Health and had over 5,000 registrants. In addition, we've had 5,000 people watch the videos of these recordings. So we know there's a demand for the information, and we just know that we need to continue to provide it as changes happen.
When I think about the dozens of examples of impact that occurred during this time, it ranged from the individual who was sewing masks at their home and actually mobilized their friends to do the same. On the other end, it was a CU Boulder BioFrontiers who went far out of their way to make sure that we had incremental PPE and lab supplies, to the partnerships that we have with Boulder Chamber and Downtown Boulder Association to think through both from a social and economic point of view, where they could be of greatest value during this time. Again, what truly made this a special moment for our community is the unique DNA of our community. It's the connectivity, it's the collaboration, it's the entrepreneurial spirit. It's the sense of possibility when you have a bold vision that you can truly accomplish it when you have the community behind you. And we had that in spades.
Is the importance of partnership. And it's not just partnership. It's specifically relationships that are so key to being successful to accomplish the outcome. We have to be able to have good relationships, to have hard conversations. So even when we don't agree, we understand where each other's coming from. That's what allows us to be able to move forward, to be able to address issues that are complex. And it doesn't matter if it's a pandemic or if it's smoking or substance abuse or obesity. These are significantly complex issues in our community. And without these close partnerships, without the close relationships, we're not going to be successful at addressing these things. They're just too complex for a single organization to be able to achieve success on. And it takes all of us.
And so we're working together to tackle this Herculean feat to get everyone vaccinated, but I think we're doing a great job and we're really moving along. And I do want to say the community's been really supportive, including foundation grants and things to help us pay for these tremendous expenses. And it's just been really heartwarming to be a part of.